name's Kim Masone, and I'll be giving the speech, Vaccines Create a Healthier World. I'm a YSU nursing student who has studied diseases that can be prevented by vaccines. I have also had to receive a number of vaccines to be able to participate in my clinical. In this speech, I will describe what a vaccine is, what some common viral diseases are, then I will continue by describing what diseases can be prevented and which ones have been eradicated. Okay. Within the last few years, the media has blown up the controversy regarding vaccines, but what are the main concerns that cause people to boycott vaccines? The main fears revolving around this topic are that they lead to autism. The idea was first brought to the public's attention by Andrew Wakefield. Wakefield published a study of 12 children that connected the MMR vaccine with intestinal problems leading to autism. Also, in 2007, Jenna McCarthy was on the Oprah show and described how her son's autism was caused by vaccines. This segment was enough to scare anybody who was not properly educated in the topic. While they have not fully proved the connection between autism and vaccines, there are still risks present. Some of the risks with vaccines are a sore arm and potentially a slight fever. In 1986, the National Injury Compensation Program was created by the United States government to reimburse families when their child experiences severe side effects to vaccines. There have been about 2,000 claims since the program started. The risks are present, but the benefits greatly outweigh avoiding vaccines altogether. If vaccines are not 100% safe, why are they still required for a child to go to school or for somebody to get a job in the healthcare field? The best way to overcome this growing misunderstanding is to educate ourselves on the topic. The definition of a vaccine is a product that stimulates a person's immune system and produces immunity to a specific disease. This protects them from the disease for the rest of their life. Alone, the body cannot fight every disease that it encounters throughout its lifetime. This is where vaccines make a significant difference. They help your body create antibodies, which then kill pathogens that enter your body. A few of the common viral diseases that we will encounter throughout our lifetime are shingles, chickenpox, influenza, pertussis, measles, mumps, rubella, and hepatitis B. All of these can be avoided by getting vaccines. Pertussis is also known as the whooping cough, and it can be easily spread from person to person. The disease presents as spells of coughing that affect eating, drinking, and breathing. The effects on an adult may be mild to severe, but if a baby becomes infected, it can be fatal. Within the last year, I have received this vaccine and have had no reaction to it. Smallpox is an acute contagious viral disease. It presents as a fever and develops pustules on the skin. Some of the pustules can be seen in this picture on the lower right-hand corner. Smallpox was completely eradicated in 1979 by the U.S. using vaccines. They were able to do this by a process known as ring vaccination. Ring vaccination means that anybody who could have potentially come into contact or contracted the disease was tracked down and immediately vaccinated. This completely stopped the spread of the disease. The more people who are compliant with getting vaccinated, the harder it is for a virus to spread through the community. The act of getting a vaccine does not just affect you or your child. For example, pertussis is a fatal disease when contracted by a baby. Since 2010, there have been about 10 to 50,000 cases of the whooping cough each year. Babies who are not old enough to be fully vaccinated have died from this disease. By vaccinating yourself, you are lowering the risk for any baby that you come into contact with for contracting the disease. As discussed earlier, the smallpox disease was completely eradicated in 1979. This means that children after 1979 no longer have to receive this vaccine. So the more The more vaccines one generation gets, the less the next may potentially need. Another benefit of vaccines is known as herd immunity. Herd immunity is also known as community immunity. The more people who receive a vaccine in a community, the more difficult it is for an outbreak to occur. This decreases the risk for the people that are unable to receive the vaccine, such as people who are getting chemotherapy or they're not old enough. There is also a correlation between the number of received vaccines in a community and the outbreak of viral diseases. This is known as a threshold for herd immunity. For example, polio has a threshold of 80 to 86%. When the numbers drop below the 80 to 86%, that's when the outbreaks begin to occur. While there are still risks with every vaccine, the benefits for you, your family, and your entire community are much greater. Because of this, there will always be an apparent need for vaccines. With every medical procedure, there are still risks with vaccines. The odds of experiencing severe side effects are very rare. Within the last 30 years, there have only been about 2,000 claims since the program started. The benefits associated with vaccines are increased immunity for oneself as well as the community. This lowers the community outbreaks and lowers the risk for those who cannot get a vaccine. Vaccines have even managed to completely eradicate a disease such as smallpox. The eradication of the disease eliminated the need for future generations after 1979 to need the vaccine. At your next doctor visit, ask your doctor to make sure that your vaccines are up to date and also try to get your flu vaccine every year. Preventing diseases tomorrow starts with getting vaccinated today. Thank you.